Welcome. Just making sure everyone can get logged on here. We'll give it another few seconds. Well, we're so glad that you guys all joined us today. We are going to be talking, of course, about bone health and osteoporosis prevention. And I'm Dr. Molly Force. I'm joined here by Dr. Rosalie and Dr. Mary, and we're part of the Prosper Natural Health Care team. We work here in Port Townsend, Washington, and we just adore working with patients to really combine natural medicine and the traditional models with conventional knowledge to help rebalance their health. And so today we're going to be talking about bone, and what we really want you to understand about bone is that it's living tissue, and that means that it is a dynamic process in the turnover that can happen for bone. So we have this remodeling that's happening of bone tissue and the cycle that happens between every 2 and 3 months. And we have a full new bone tissue turnover about every 7 years, which is pretty remarkable. And this is a big deal because a lot of times we're talking to folks that have had significant bone loss and they're feeling pretty defeated. And we just want you to know that there is this rebuilding process that naturally happens for the body, and we want to be supporting that. So there are two major types of cells that affect this bone remodeling. There are osteoblasts, which are the building, they build the bone tissue. And then there are the osteoclasts that are breaking down the bone tissue. And we may be referring to these during this presentation, but generally we're really trying to support the osteoblasts in their activity to really help reduce bone breaking down. So we want to talk with you guys about this general timeline that happens and this progression that happens with bone tissue as we age. And as you can see, for males and females, there are different peak times of bone tissue being at its height. But as we're growing as children, our bone tissues are also growing, our bone mass is also growing. And really, between 25 and 30, we typically are hitting our peak density for that bone tissue. And then we start what we hope is a more gradual decline. Now, in males here, we see a slower decline. In females, we can see quite a stark drop off that happens here. And we're going to talk to you guys about the risk factors that are really influencing that here. But one of the biggest we're going to really discuss today has to do with hormones, and specifically estradiol, which is one of our very active estrogens in the body, and how that influences this osteoblastic and osteoclastic activity, so that remodeling of the bone. So we see that impacted right here. And on average, after we hit about 50 years old, we start to lose about 0.5% of bone every year. So that really can compound fast for people. So this is a nice visual here for you of what we see as normal bone tissue. And you can see bone looks kind of naturally porous. We can see all these holes within it. And if we get more bone thinning, we have what's called osteopenia, and then it can progress into what's diagnosed as osteoporosis. And we're going to talk about, when we're doing DEXA scans, we're going to give you guys some specific numbers to watch out for today and things like that. But we want you to have this visual of what it looks like when that bone matrix begins to thin and become more brittle. And of course, osteoporosis and even that thinning of the bone, osteopenia, they're classified as silent diseases. So it's not until we get into this more severe zone here of osteoporosis that we're greater risk of fracture, and those bones are becoming weaker. And so that we can see symptoms if we're to have a basic fall and cause a break at that point. So, our goal, of course, if we have patients who are severely osteoporotic, is to push them back towards osteoporosis and then towards the osteopenic zone and working towards that normal bone tissue. And so we want you to all think about where you are currently, what you're trending to do with your body, and thinking about family history for that trend as well. And think about this as a really important preventative thing that we can be doing for our body to help prevent further bone weakness and degeneration.
Thanks, Dr. Molly. So, in terms of how do we test for osteoporosis, right? It's usually through a DEXA scan that this gets tested and diagnosed. And DEXA scans typically aren't recommended until about 65 years old, right? And so, unless you're a high risk patient, that's usually the recommendation, is that we just start with this scan at 65 and see where you're at. And the scan looks at, the big joints of the body, the hips, the wrists, the shoulder joints, etc. And it looks at the spine as well, and it sees how much bone loss there has been. And it measures it in terms of a standard deviation, right? If you can imagine a bell curve, right? And if you're below the standard deviation, up until 1 to negative 2.5, that's what's known as osteoporosis. It's sort of scored in this way. And then or osteopenia, sorry. And then if you're beyond the 2.5, lower than the other folks, that's sort of where it's defined as osteoporosis. And different bones of the body can have different sort of levels per the DEXA scan. High risk patients, we can scan earlier, right? These are usually women who are either thin in their body frame, or who have history of a lot of fractures, or who have family history of osteoporosis, or who have had some sort of hormone related procedure where we removed the female hormones, from breast cancer treatment to hysterectomies, right? So those are the kinds of folks that we will scan sooner to get to see how the bones are affected sooner, so that we can have a treatment sooner ultimately. There are other ways to look at how the bones are responding. X-ray, of course, can tell us how much compression there is in the spine, which is a common site of osteoporotic fractures. Urine tests tell us ultimately how fast the bone is being broken down, and ultimately what's coming out in the urine, right? If there's calcium in the urine, for example. Blood tests tell us, in a similar way, if there's a couple markers we look at pretty closely, from minerals to enzymes, to see how the bone turnover is actually being reflected per the blood work. And then lastly, usually this is not one of the first things we do, but we can take a bone sample actually with a biopsy and look at, under a microscope, how severe the osteoporosis is, etc. So here's sort of the way we quantify bone loss with the T-score on the DEXA. Like I'd mentioned, it's looking at a standard deviation. You're at osteopenia from -1 to -2.5. Anything below -2.5, it's defined as osteoporosis. And so the bones that are especially at risk are your wrist, your spine, especially the lower spine and the cervical spine, as well as the hips. And so as you can see in this graph here to the right, it it takes 50-year-olds up to 85-year-olds, and it shows over time, over that span of 35 years, how what's the risk of a fracture as we age. And ultimately we'll walk through why the aging process ends up sort of leading to bone deterioration, and ways we can sort of prevent that earlier, um, rather than kind of treating it later. So I'll hand this slide off to Dr. Mary.
Okay, thank you, Dr. Rosalie. So, who's at risk for osteoporosis? Typically, the people that are most at risk are going to be females that are postmenopausal. And this is for a number of reasons. We find that, well, so first of all, estrogen is a major factor here. So as we age, and particularly after menopause, when we're producing less estrogen, this is going to accelerate bone loss. And this is because estrogen blocks bone reabsorption. So females are 4 times more likely to develop osteoporosis over the course of their lifetime. And another reason for this is that a larger stature is going to allow you to build bone more consistently. So as we've discussed, our bones are living tissue that are responsive to stress, and I mean physical stress. So if you have more weight on them, they're going to respond by building a more dense, strong structure. So when we have individuals that are thin in build or frame, that's going to put you more at risk for osteoporosis. We also have women who have had low exposure to estrogen in comparison to other individuals will be more at risk for osteoporosis. So this will happen when people have a late onset of menses or early menopause. And that's just because that kind of estrogen dominant phase is a shorter duration over the course of these people's lifespan. We'll also see it with estrogen blocking medications like in cancer therapies, and we'll discuss that a bit later. This can also be a problem with anorexia or bulimia, partially because there's not enough weight, not enough fat to provide extra estrogen stimulation. So a lot of our estrogen stores come from our fat cells, and particularly when we're postmenopausal, that's the main source of estrogen in the body. So important to think about, a balanced weight is really ideal. And when you get into the category of not having enough fat, you're losing some of that estrogen stimulation over time. This can also, hyperthyroidism can be a big factor. So thyroid hormone will over time cause bone breakdown. So if you have too much thyroid hormone circulating in your bloodstream, that'll be a problem for maintaining bone density. We also find smoking and alcoholism will affect bone density. Specifically with alcoholism, it'll decrease calcium absorption. And then depression. So we know that noradrenaline harms bone building cells, and often there's many confounding factors that come with depression, like less exercise and things of that nature. But that has been shown to be a risk factor. So some medications that cause bone loss. We've got corticosteroids. When these are used for a long period of time, we'll see that we can have impaired bone building. It does not apply to a steroid burst or taper that's often needed for short-term management of various inflammatory issues. But we see this more with long-term use of corticosteroids. We'll see this with breast and prostate cancer therapies that block the effects of estrogen and testosterone. So, and that's for the reasons we were discussing, that estrogen blocks bone reabsorption, so keeps us building bone and not breaking it down. We'll also see it with proton pump inhibitors or antacids that contain aluminum. So aluminum is going to impair the absorption of calcium as well. And proton pump inhibitors and antacids are often used for gastritis and GERD or acid reflux. And not having enough stomach acid around even can affect the body's ability to break down some proteins and animal products. So that will affect calcium absorption as well. Next, we've got diuretics can cause increased excretion of calcium through the kidneys. And then other medications that can contribute to bone loss include blood thinners, anti-seizure medications, thyroid medication. If you have too much thyroid, again, that thyroid hormone can increase bone reabsorption. And then mood stabilizers containing lithium. These are all things to, not that you should just stop any of these immediately, but they're things to think about and to mention to your healthcare provider if you are on these and struggling with osteoporosis or osteopenia. So signs and symptoms of osteoporosis. This is largely a silent disease, and we will, see the effects of it later on in life unless you're screening with the DEXA scan. So that's the importance of this. The importance of the screening is you really want to catch this earlier on and prevent it as much as possible. So once there's a progression of this loss of bone density, sometimes we'll see a loss in height of 1 inch or more. And that is because of the vertebrae losing their structural integrity. We will often see a stooped posture. So the sort of head tilted forward and the upper spine tilted forward. And that is again because of fractures or degeneration of those vertebral bodies in the spine. And then we'll often see back pain for the same reason. There can be compression of the nerves with the degeneration of those vertebrae. And then finally, we'll see that low impact fracture. So, this is the type of fracture that doesn't happen when you're in a car accident. It happens when you're walking down the stairs or fall from standing. And this is typically seen with 30% bone loss backing up. Typically, we'll see at least 30% bone loss before these symptoms appear. So again, prevention is really the name of the game here. All right, so in the conventional approach to managing osteoporosis, one of the main drug classifications that's utilized is bisphosphonates. So these stop osteoclast activity, and remember, osteoclasts are the ones that are breaking down bone. So these stop those from doing their thing. This can be really important for some people who have advanced osteoporosis. There are some significant drawbacks, though. One of them is that because bone remodeling is something that happens in an adaptive way, our bodies need to remodel bone to adapt to structure and create strong bones. This can actually weaken the bone matrix over time, even though it's slowing. It's kind of like a stopgap measure, stop the bone breakdown from happening. There's also some significant side effects, including esophagitis or inflammation of your esophagus, and esophageal ulcers, headaches, abdominal pain, acid reflux, nausea. Again, these are all just things to keep in mind when you're deciding which route you want to take, and a good thing to talk to your healthcare provider about. But it's also important to remember that you still need to take calcium and vitamin D3 in this process. And again, I sound like a broken record, but we really encourage people to pay attention to their bone health early on in life so that you can prevent having to use those phosphonates later. All right, so now I'm going to hand this off to Dr. Molly to talk about goals with our patients.
So we know that this is why you guys are really here, is to understand some of the supportive things that we can do from a natural perspective for bone. So we wanted to talk to you guys about our goals that we have as the clinic for our patients. And the first and foremost is really to find this physiologic balance. So it's figuring out what the body needs to re-establish balance. So if we have excessive bone loss, we want to figure out ways to slow that bone loss, and at the same time, ways to restore the rebuilding of that bone. We want to make sure that we're providing these protective benefits, and we have been able to kind of come up with 5 different sectors that we focus on with our patients in regards to bone health, and we're going to go over those with you here. So the first one has to do with exercise and gravitational load. So we're going to discuss that. We need to make sure we're reducing inflammation. We know from the medical literature that osteoporosis is actually an inflammatory degenerative issue. So we want to really put the brakes on that inflammation. We want to make sure we're providing enough of the minerals and the nutrients that we need for that bone matrix to be built. We want to make sure we're supporting our flora, and that actually has multiple inputs and reasons why that's so very important, but it can even affect how we're absorbing our nutrients, and then even as far reaching as our hormones. And then we want to make sure that the hormones are balanced, because we know that estrogen has such a direct effect on those bone building cells. And then ultimately, we need to help our patients manage their quality of life. So if we have somebody walk in with severe osteoporosis, we're having very serious conversations with them about whether or not it's appropriate to be on or to start pharmaceuticals, and do those things hand in hand with some of the natural approaches. So first and foremost, we want to make sure we're using gravity to our benefit. So number one is this weight-bearing movement. Now, most of you have come to this talk already knowing that people quack on and on and on about how important weight-bearing exercise is. The reason for that is that it's the gravitational, or the weight itself, that pulls on our tendons and allows our tendons to trigger cellular signaling at the level of the bone. And by doing that, it stimulates this proper building and turnover of that bone matrix. So our osteoblasts, our bone builders, require mechanical stimulation. Now, just this morning, we were fortunate enough to have a patient that we've been working on bone density stuff for many years with. And she happened to come in and brought her most recent DEXA scans. And we were able to see an 8% difference from improvement from this year's DEXA in comparison to her DEXA that was done 2 years ago. And the number one thing that she did was she added on a very routine exercise program. So we cannot overemphasize the importance of using mechanical stimulation to provide building of the bones to specific regions. So we can start that with our posture. So take a second and think about your posture right now. Remember, even though We're cerebral beings as humans. We're ultimately these organisms that are all under the impact of gravity every moment that we're on Earth, essentially. So our postural stack, how we're holding our heavy skulls with these big brains in them, affects that cervical spine and every single spinal segment all the way down the line. So if we're seated, we want to be thinking, making sure our ears are aligned over our shoulders, and our shoulders and our rib cage are aligned over our hips. So when we're standing, this is also impacting us, obviously, into the hips and pelvis. And it's important to be thinking about just day to day, how do you sit? Are you sitting in that rounded forward position on the computer, hunched forward, or are you stacked properly? Because that gravitational pull will be affecting your bone tissues and how those tendons are being pulled for the muscles and touching those bone signaling cells for bone growth. So ways that we can get our exercise in, of course, starting out with the base walking, but thinking also about some of these weight-bearing exercises where we use our body as the weight. So that's the things like the Pilates and yoga. Then we can start to add in weights as well. So weightlifting, whether it be free weights or with weight circuits, and then balance exercises. And balance exercises are going to be critical because they're sending a message to your cerebellum, which is right back here. And your cerebellum is going to tell your body to find balance posturally against whatever the gravitational pull is. And when it does that, it's telling certain tendons to turn on and do their job and hold your muscles and your skeleton in a certain way. And by doing that, we're impacting those bone cells. So unfortunately, biking and swimming don't really help us when we look at the medical literature as much with the bone building piece. We love them as exercise routines, but unfortunately, as far as I can tell, biking and swimming aren't going to be our number one options here for bone rebuilding. Now, make a challenge for yourself. We're really, really close to the new year for a lot of us here. And that means that it's time to be thinking about what our movement routines are going to be. This is often the hardest time of the year to have a movement routine because of the weather shifts that happen with winter. But really make it a priority and make it a goal for yourself. Figure out what will work for you and start small. Now, one of our favorite tools here at Prosper are these vibratory platforms for bone rebuilding. And these can be used in a few different ways. You can see here, this is a model that doesn't require hands being holding. Well, and that will allow you to really get into some of these upper body positions. So you can be working in to the wrists and the arms. So remember, when we fall, one of the first things that goes out is our wrists, and we can get these really common fractures that happen in our wrists, which means and these are slender bones. So if we have osteoporotic activity, we really want to protect our wrists. So getting these vibratory platforms and having those as an exercise option can be really phenomenal. Now, what they're doing is they're providing this shaking, this oscillation activity in not just the XY back and forth axis, but it adds in this dimensional extra X, Y, and Z axis that allows there to be this almost like spherical motion. And that keeps the cerebellum guessing, where do I go? How do I stay balanced? And so constantly you're having these tendons triggered to hold the bones and hold the muscles in place to correct balance. And that's exactly what we want to really speed up our therapeutic time frame here. So they can be used just passively standing or just passively sitting or doing these kind of plank poses on them. And then they can also be used to get into certain segments. So if you know from your DEXA that you have quite a bit of deterioration of that bone along the lumbar segments, that lower back segments, then you can be doing seated exercises on a vibratory platform and doing spinal flexion and extension and rotation into that lower spinal segment to really spotlight those areas to get them to be triggered, mechanical triggering once again for that building. Another excellent tool that we love to recommend are these weighted vests. Now, these are available online. They're pretty easy to access. What we really like to recommend is that people start with these removable weights. So it's great because you can get a weighted vest and then work your way up with your weights as your body allows and as your strength builds. So before you go on that very needed, wonderful walk, so good for the rest of your body and your brain and your metabolism and your blood sugar, and ultimately your bones, because you're going to keep that wonderful posture while you're walking. Adding that weight bearing vest can be just phenomenal for the bone density. And we see a lot of our PTs in the area who are working with osteoporotic patients of ours recommend these weighted vests because it really does speed and help impact and make that time that they're spending on the exercise more effective. So as far as the next goal, I'm going to pass this along to Dr. Rosalie. She's going to talk about inflammation and why that's so critical.
Thanks, Dr. Molly. So this is our second goal here. We already talked about weight bearing, movement as ways to rebuild bone, but this is sort of osteoporosis requires a multi-pronged approach. So when it comes to managing inflammation, we've got to think about our EFAs, which is our essential fatty acids. And that's an umbrella term for our omega-3s and our omega-6s. So linolenic acid, which is on that left-hand side, is kind of the precursor to our omega-6s, which are typically more inflammatory. And then on the right side is alpha linolenic acid, which is a precursor for our omega-3s. And in our current sort of Western diet, we typically have an overload of the omega-6s, which, like I said, are more inflammatory, and just a functional deficiency of our omega-3s. So it's just worth thinking about what types of veggie oils you're using, and also marine oils like fish oils or algae oils, and trying to pull more in from the omega-3 side of things and less from the omega-6s. So some examples of omega-3s are our fish oils. If you are vegan, they can also be derived from an algae source. Butter from raw, whole, unpasteurized milk from pasture-raised cows, not grain-fed cows. Those are the ones that contain the most omega-3s. Ultimately, think about what these bigger animals are eating, right? If it's a high-grain diet, it's pretty inflammatory, right? And that meat would then be pretty inflammatory as well. Extra virgin olive oil, also a great source of omega-3s. Unrefined flax oil. Make sure if you are purchasing flax oil that you keep it in the fridge or the freezer. It goes rancid pretty quickly, and it's got to be in an opaque container. Coconut oil is another good one. Egg yolks, raw nuts and seeds, but again, making sure they're not rancid, right? So they haven't been sitting in a bulk bin for a while. Otherwise, you would be having it would be turning more into an inflammatory type of oil at that point. And lastly, if you're unfamiliar with avocado oil, that's a really excellent one to bring in on board. Another way to combat inflammation is with antioxidants. And ultimately, antioxidants are found in the rainbow of foods that we eat. So something that I say to my pediatric patients, but even my elderly patients, is try to eat the rainbow ultimately, because it's got all the antioxidants from the orange beta carotenes to the purplish anthocyanins, right? These are the antioxidants are going to be scavenging the free radicals that cause oxidation, which means they're causing inflammation in the body. The more inflammation, the more bone turnover, the more osteoporosis ultimately. Another goal we've got here is to balance our diet, and it has to do with mineral intake, okay? And what this goal goes into is a discussion of not just, calcium is required for bones, but all the other multi-minerals that are required for building healthy bones, which require a bunch of building blocks. So the components include not just calcium, but magnesium, phosphorus, strontium, and boron as well. So calcium can be found in our dark leafy greens like our broccolis or cabbage family, or in our fruits, citrus fruits, and it also can be found in some grains, right? Often we think of calcium being found in purely dairy products, but it's not the only source of calcium. And ultimately, when you think about eating the rainbow, try to get your calcium from a variety of sources, not just sort of the white ones. So the other minerals can be found in foods as well. So calcium requires magnesium on board in order to be deposited into bone. So magnesium can be found in sea vegetables, in whole grains, in nuts and dark leafy greens. It's often paired in the same types of foods that as the calcium containing foods that are the grains and the veggies. Boron as well is just a micromineral that often gets forgotten about, but it's one of the building blocks of the healthy bone structure. And it's often found in dried fruits and nuts. Prunes are a pretty good source of boron, surprisingly enough. Strontium is the third one that maybe you've heard about more recently, since I know there's been a lot of a big push on social media, kind of talking about strontium as being a helpful mineral for osteoporosis. And indeed it is. It's just worth noting that if you are taking a strontium supplement, to take it away from your calcium supplement, because they sort of interfere with each other's absorption. Strontium can otherwise be found in foods. It's ultimately from the soil and from the seawater. So seafood again, sea veggies, unpeeled veggies, whole grains, you can sort of get the idea here. So ultimately, this is all a plug to eat our anti-inflammatory foods, and part of that anti-inflammatory protocol is to get your food from an organic source, especially because if we're trying to get those microminerals, we're not peeling our veggies, and a lot of those microminerals are actually found in the peels. So another piece here to think about in terms of diet is to avoid the foods that are going to be competing with the absorption of the calcium and of these other microminerals that build bone. So phytic acid is something worth talking about. It's got the word acid in it, right? It's a way to remember that when we've got more acid moving about, we're actually pulling away at the bone. And ultimately, this happens in the GI tract, where the phytic acid will bind to the minerals such as iron, zinc, magnesium, and calcium, and prevent them from being absorbed. So phytates are found in grains, whole wheat, that haven't been soaked, right? So part of the way to get rid of the phytates are actually to soak the grains, soak the legumes, soak the nuts, for a little bit, to sort of move to get that layer off of the food. And lastly, soda pop also has phytates. I'm assuming none of us are drinking that these days, but it's on this list anyway. So when it comes to supplementing calcium, magnesium, if even with the food on board, the added foods with those microminerals on board, we might still need to supplement. And this is worth having a big discussion about, because like I mentioned, calcium sort of needs magnesium with it in order to be best absorbed. There's all sorts of different supplements out there, and the sort of most absorbable forms of the calcium are either the carbonate or the citrate variety. The most absorbable forms of the magnesium are the glycinate or the malate varieties. You can get all sorts of different forms. Liquid, powder, capsule are sort of the most preferred. I noted on there not to get the calcium in a tablet form, because it notoriously just kind of runs through the body and comes out in the feces that way. So it's worth thinking about, if you are doing a CalMag supplement, thinking about the kind and the form that you're taking. A good rule of thumb is to do a 2-to-1 ratio calcium to magnesium. That's sort of the best amount for absorption. And the best time of day to take it is in the evening, actually, especially because that magnesium helps with insomnia, helps kind of with winding down and anxiety as well. And then you could take it with or without food. This depends on kidney health, and specifically if you've had a history of kidney stones, you would want to take that product without food. So here's one of the physician grade supplements we carry here. It's a liquid calcium magnesium that has a berry flavor to it, but it's also got some therapeutic microminerals in it, vitamin K, as well as a boron and calcium magnesium combo in that ratio. And then lastly, another product that has been talked about recently is red mineral algae as a source of calcium. And it's specifically a calcium carbonate. And the reason I think why red mineral algae gets so much hype right now is that it's sort of a natural form of calcium, but ultimately it's the same product as the synthetic when it comes to biochemistry. It's not very well studied, surprisingly enough. I sort of dug into the literature yesterday and tried to find more information about this red mineral algae calcium, and there's some small studies that are observational in less than 200 women that shows that it increases bone mineral density by 1% yearly, which is a pretty impressive number, since we know that bone density diminishes by about that much every year just with natural aging. It also is shown to diminish inflammation in the GI tract, which is another way to combat osteoporosis. But ultimately, at the end of the day, I'm not 100% convinced that this type of calcium is the best one for combating osteoporosis. So this slide here is on magnesium. And I talked a bit about magnesium before in terms of it needing calcium alongside it for both to get well absorbed. But magnesium also has other effects. It supports healthy sleep. It supports muscle function, especially the magnesium malate variety. And it's good for your cardiovascular system. It helps with arrhythmias specifically. The various forms are here to refer back to. Magnesium citrate is the one that's not as well absorbed, but it's helpful if you've got constipation because it's sort of a natural laxative. Magnesium malate and glycinate are the better absorbed ones. Malate sort of has this other helpful piece that it's used for muscle cramps. Glycinate has this other helpful piece in that it's helpful for anxiety. Vitamin D3 is another vitamin that's essential for building bones. And in the Pacific Northwest, it is a common deficiency amongst our patients. Part of our annual panel of lab work includes this vitamin D test, and I chronically see it come back really low on a lot of my patients. Vitamin D is required for building healthy bone, and we can get that from sunshine on our bare skin. We can get it from food, especially liver sources and cod liver oil. And honestly, probably the easiest way to go about it is through a supplemental form, liquid or capsules. I often check vitamin D on my patients to ensure that they're within the healthy range and we're not super low, but we're also not super high, right? Because high vitamin D can be detrimental to bone in that it hardens it so much that it sort of makes it act more like marble and can break that way. So there's definitely a fine line in terms of vitamin D. So I recommend getting that one checked as part of an osteoporosis regimen. And lastly, vitamin K is another really helpful vitamin for building bone. K2 specifically is the one that increases bone density and reduces fracture incidence. So when you go back into your supplements and look at what you're taking every day, make sure that you've got these multi-minerals and vitamins on board. And especially in these forms, the D3, the K2. Probiotics are really amazing in that they help pull vitamin K out of your food in your GI tract. So a healthy gut that is not inflamed is helpful in absorbing vitamin K. Foods that are high in vitamin K are going to be our molasses, our dark leafy greens, green tea as well, oats, and alfalfa sprouts.
All right. Thank you, Dr. Rosalie. So also thank you, Mary and Christine, for letting me know that you weren't able to hear me very well in the first part. How is it sounding now with this volume? Can you hear me? Okay. So let me know if there's any questions you have about the previous content I was talking about. So next we're going to go into talking about gut health and how it relates to osteoporosis and osteopenia, and specifically the gut microbiome. So when we're talking about the bones, you might be really, oh, okay. Sounds like it's still hard to hear me. I'm just going to speak really loud. Okay, so you might be confused when I ask you about your poop when we're talking about bones, but that's because as naturopaths, we're really taking a systems-based approach, and our gut can impact so much of our physiology that we really take that into account in almost every medical condition. So when it comes to osteoporosis, our microflora, which are our beneficial gut microbes that help us with a lot of our physiologic processes, will affect the absorption of nutrients and microminerals in our gut. It can also have a huge impact on our inflammatory response. So there's a lot of crosstalk between the microbes in our gut and our immune system. As you can see down here at the bottom, 70% of the immune system is found in the digestive tract, in a part of the immune system known as the galt. And that is, so there's a huge connection between our gut health, our microbiome, and the inflammatory state of our body. And again, as Dr. Rosalie was discussing, that can have a huge impact on our bone mineral density as well. Our microflora can affect our hormone management. So when it comes to our estrogen metabolism in our gut, certain microbes can help us deconjugate estrogen and send it back into circulation or send it out of our system. So that's a huge process that can affect the estrogen mediated impact on our bones. And then our microflora can even affect the way that we are able to metabolize phytoestrogens, which Dr. Molly will talk about in a little while. But a certain microbe called Schlackea that comes with a really diverse microbiome will make soy more effective because you're able to turn the active metabolites of soy into equal, which is what will affect our system on in an estrogen-like way. So generally, when it comes to considering probiotics, we want to choose friendly digestive bacteria, including Lactobacillus acidophilus and Bifidobacterium. So those are just two of the many that we'll consider in a probiotic formula, depending on what someone's struggling with. We also really want to include prebiotics, and we'll discuss that more in a couple of slides, in addition to our fermented foods. So some food sources of probiotics. So these are foods where we've used the fermentation process to encourage the growth of lactobacillus in a culture, if you will. And so that will be with active cultured yogurt, kefir, kimchi, sauerkraut, kombucha, miso, tempeh, all of these things. With kimchi and sauerkraut, you want to make sure to get the raw forms so that they're not pasteurized. Those tend to be in the jars at the grocery stores versus the big bags of sauerkraut. And you want to think about adding a couple of tablespoons to whatever meal you're eating. And that's a really great way to add more fiber and probiotics. And one thing to note about that is they are high in salt. So sometimes if I'm going to add some salt to my food, I'll just use that instead of adding that in addition to table salt. So thinking about some food sources of prebiotics. So again, prebiotics are fermentable morsels for the gut microbes to have their feast on. And these they're often used to produce other things in our gut, like butyrate, which is the food for the cells that line our colon. So they're using these foods to create essential nutrients and minerals that we use in our gut. So some of these include, I'll let you look through this list here, but having a variety of fibers is really the sort of most important thing to think about when you're getting prebiotic foods in your diet. All right, and just lastly here, your poop knows a lot. So it's a good thing for you to just look in the toilet bowl and see what's happening. It's a kind of a reflection of your internal state, and then you can report back to us because we will ask you.
So let's talk hormones. We've got a few different ways when we're working with folks to really affect hormone balance and provide extra hormones to go as a naturopathic clinic. So we can not just use the conventional prescription hormones, which come with a lot of concerning side effects and potential cancer risk, but we also have the ability to use things like herbs, which contain these hormone-like chemicals that will mimic the hormone activity in the body and can be safer to some degree for certain folks. And we have the option there to use phytoestrogens, phytoprogesterones, and phytotestosterone. So depending on what area we need to support balance in, we have those options. And additionally, we prescribe quite a few bioidentical hormones here at Prosper, and working with the individual to come up with a proper balance for them in providing that prescription and maintaining that prescription by looking at their hormone testing to make sure that they're in a physiologic balance. So when someone walks in with osteoporosis and they already have that diagnosis of osteoporosis, not necessarily osteopenia, but when they're in osteoporosis and they're asking for one of the most important ways to affect their bone density in a short period of time, other than the weight-bearing exercise, hormone balancing is probably the next most stark shift that can be done for folks. And so we're often at that point looking at their labs to see what area of the hormonal cascade is affected for them. And if, in fact, they do have low estrogens, we want to understand which of those estrogens are low. We want to understand what their risks are for estrogen-dominant cancers. And we want to have that discussion with them about whether or not it's appropriate to supplement either in a phyto, very natural herbal option or plant-based hormone, or for us to use bioidenticals at that point. So let's talk more about these phytoestrogens. They're pretty phenomenal. So remember, they mimic, like a chemical key, the same components, the same chemical structure that our natural estradiol estrogen will in the body. And so they work like keys in these receptor sites, these hormone receptor sites, to trigger a chemical cascade as if the hormone itself has been delivered. And these are totally naturally derived. They're found in lignans and isoflavonoids. Probably one of the best studied in regards to bone density is genistein. And that one has been shown in clinical research to promote metabolic maintenance, so like weight loss, as well as increased bone density. What happens is these phytoestrogens are actually converted in the gut to mimic these estrogenic compounds. So that's what Dr. Mary was talking about when she was saying it's really crucial to have your gut microflora doing the proper thing and having a nice variation of that flora, a nice wide diversity, so that they can handle these compounds as they come in. We know that phytoestrogens are very effective as estrogenic activators in the body, and they can modulate things like uncomfortable hot flashes and difficulty with, vaginal dryness and things like that as women go through the menopausal transition. We also know that phytoestrogens can increase that maturation of the vaginal cells. So once again, that's how that can affect with vaginal dryness. And we know that there's tons of literature out there showing that they can be very effective in helping to inhibit the osteoporotic bone breakdown pathways. So different sources might surprise you. It's not just soy. So there's a lot of these foods, if you look at this picture, that you might say, oh my gosh, I have carrots a few times a week, or I'm eating an apple every day to keep that doctor away. Whatever, whatever you might be thinking there, it's kind of surprising, at least it was for me the first time that I really did a good review of all the phytoestrogens, of how much we naturally are getting these in when we're having a nice diverse diet. So even things like celery and parsley are technically phytoestrogenic. Now, unless you're having really large quantities of these, they're not going to provide you with a very tangible increase of estrogen in your body. Like, you shouldn't be noticing symptoms from that, but it can be enough to help modulate some of these cellular receptors and affect bone if we're having a nice diverse diet. So something to think about there. Now, one of the products that we use quite a bit here at Prosper is called Osteoben. Now, this is a Designs for Health product, and one of the things we like about this is it has some really good clinical data on it, showing that when you combine really good forms, really bioavailable forms of calcium and magnesium, both in the malate form, as well as a proper form of K, which is that K2, and vitamin D, then we can activate this healthy bone construction and reconstruction and reduce that breakdown. So we also know, once again, remember I mentioned genistein is a very strong phytoestrogen for bone activity. This one really helps, once again, with that cell metabolism and helps the bone turnover. And it's in this product, which is one of the main drivers for us using it with a lot of patients. So even in some of our patients who have risks of estrogen cancers, this could be potentially a safe product for them. And it's one that we talk about them on an individual basis and discuss the action of the genistein in there, because it is pretty darn safe phytoestrogen. So I'm going to pass this off to Dr. Rosalie now, who's going to talk about some Ayurvedic options for bone support.
Thanks, Dr. Molly. So this is kind of this wraps up our doc talk where I talk through an Ayurvedic perspective of osteoporosis, and then Dr. Mary will talk about a traditional Chinese perspective of osteoporosis. And so when it comes to Ayurveda, it's the traditional medicine of India. In Sanskrit, it's the science of life. And the imbalances that are seen in osteoporosis specifically have to do with a concept known as low ojas. And ojas is like your life essence, is kind of the core that makes you vital. So low ojas would mean that all of the tissue layers, which there are 7 tissue layers, they would all be sort of deficient. The 5th layer in Ayurvedic medicine is what's known as the Asti Dhatu, and that is the layer that corresponds to the bone. And you can tell essentially about the inner bone status by looking at the teeth, hair, and the nails. So if the teeth are brittle and they're getting a lot of cavities, if the hair is falling out and it's not, it is quite dry, if the nails are splitting, this tells us all about the inner bone health, and would be a way in Ayurvedic medicine of defining osteopenia versus osteoporosis. So some ways that Ayurvedic medicine tackles this problem is to use certain herbs and diet and lifestyle therapies for building bone back up. And sesame is a really big one that I see get used often for this, because sesame is calcium rich. So I'll have some of my patients just take a spoonful of sesame or just sprinkle it onto their salads as just a way to get in some extra calcium. Shilajit is another Ayurvedic herb, which is actually what's known as a mineral pitch. So it's basically sap of sorts that comes out of rocks in the Himalayas, and so they capture this and encapsulate it. So you can imagine it's high minerals, so it helps with the mineral needs of the bones. A diet that would be helpful is one that is nourishing, right? That one that is low inflammatory. And part of this nourishing diet would include Tulsi tea, because it builds that first tissue layer. And once we build that first tissue layer, we can go all the way down the 7 layers, that 5th one being the bone layer. So it has to do with supporting. It's a whole body perspective ultimately. In terms of lifestyle that could be helpful, we're thinking about easily digestible foods that are warm and soupy, with a lot of water content in them, that are spiced, not with hot spices, but with digesting spices such as ginger, and then nut milks as well. Would be very building and nourishing for all the tissue layers. A daily oil massage is a way to stimulate the skin, and sort of, especially with a medicated oil specific to your Ayurvedic type, could be a way to sort of ground the air and space elements that would otherwise be bringing air and space into the bones with osteoporosis. And lastly, some stress management like yoga and meditation, especially with good posture, would be helpful for osteoporosis. If you think about yoga, yoga is a way to prepare the body for meditation, ultimately. So in doing yoga, you are able to sit well with good posture for your stress relieving mindfulness time.
Right. Thank you, Dr. Rosalie. So next, I'm going to talk about the traditional Chinese medicine perspective on bone health and some ways that we can promote bone health through acupuncture and Chinese herbs. So from the traditional Chinese medicine perspective, it's actually somewhat similar to the Ayurvedic concept. There's this thing called the kidney essence, and it's something that we're born with a certain amount of. Some are born with more than others. And louder, okay, sorry, thank you. So the kidney essence, some of us are born, it's something we're born with, and some of us are born with more kidney essence than others. And it regulates our bone development and metabolism throughout our lifespan. And this kidney essence declines with age. So in each kind of phase of life, it declines. And so from a Chinese medicine perspective, what we do throughout our lifespan is to support our kidney essence. And from a Chinese medicine perspective, that means building kidney qi, and kidney yin and kidney yang. Don't worry too much about what those words mean if you don't already know. I'm going to talk about this kind of from the Western medical perspective as well. So when it comes to treating osteoporosis, as it in and of itself, I'm largely using Chinese herbal medicine because it contains a ton of herbs that are phytoestrogenic and immune modulating that can be really helpful from a Chinese medicine perspective, building kidney qi and essence, and from a Western medical perspective, supporting our estrogen stimulation. So one of the most famous formulas is known as Zuo Gui Wan, or Restore the Left Kidney Pill. And this is one that we use when the kidney yin is low. So yin is in the yin and yang model. Yin is our cooling, nourishing, grounding substance that can decline postmenopausally. So this is a formula that we use often when someone's having pretty significant hot flashes, afternoon fatigue, and other signs of yin deficiency that match pretty well onto a lot of our menopausal symptoms. So this formula has been shown to stimulate the growth of bone-specific stem cells, which is super interesting. And so this is just one of many formulas that I would consider based on your overall picture. And as you can see here, it contains many different herbs that all work together in different ways. So here are some specific herbs that we would consider. One is called yin yang guo. This one strengthens the kidney yang. So versus the yin, which is nourishing and grounding, yang is activating. It's kind of the active, energetic side of that equation. And this one has been shown to stimulate osteoblasts and inhibit osteoclasts, which is what we want in osteoporosis. And then lastly, we have du zhong, which translates to bone knit. And that's on the lower right-hand side there. And this one contains quercetin, which reduces bone loss likely via an anti-inflammatory action. So all very interesting specifics about these Chinese herbs. Now I practice acupuncture at Prosper as well. And while I wouldn't necessarily use acupuncture to support osteoporosis directly, it can be really useful if you have any osteoporotic fractures and resulting nerve pain and damage from that. So that's something to consider asking about if that's something that you're struggling with.
Thanks, Dr. Mary. So we want to invite you guys to this new thing that we're going to be doing for this next year. We're really excited. We're kind of shifting our doc talks into more clinical spotlights. So because we've done a ton of different topics and they're all available on our video, our video online website about on our education page, and you can watch them at any point. We wanted to make sure that we were providing really up-to-date information about clinical questions that are often coming up in practice. So next month, we're going to be talking about intermittent fasting and whether or not it helps with things like longevity or kickstarting weight loss. So it's a pretty hot topic right now in the natural health sphere. So we thought we would start with that one. They're most likely still going to be on the second Tuesday of the month, but look in your email for more information on that, and we'll update that on our website too once we have that set. But we're looking forward to that. And then, of course, if you have questions that are specific to you or think that you need help with managing any piece of this or need more testing, we are really here to do that for you. That is our job as experts in the natural medical field. So please give us a call or check on our website and request an appointment that way, and we can chat with you. And I am having a hard time pulling up my chat for some reason. So Dr. Mary or Dr. Rosalie, do you mind kind of checking in on that for me and seeing if there's any questions that came up?
I don't see any questions on the chat, but we can hang out for a few minutes if folks have questions, or you can always give us a call if something comes up after the doc talk. These doc talks do come out probably 24 hours after they've been presented. So you can always refer back to the recording later too.
But any questions? Okay, if not, we're going to say happy holidays. We hope you guys are all safe and well, and we hope that you took away some gem of information today about bone health and ways to really keep yourself strong and well moving forward. Right, thanks.
Can I ask a quick question?
Oh yeah, hey, we've got you on audio. What is it?
I just had my third DEXA scan 2 weeks ago, and I'm sort of vacillating between osteopenia and osteoporosis. I'm 68, doing all the supplements. I don't have risk factors that I know of, but I increased density in my lumbar spine in 2 years, kept the hip stable, but my left wrist was like significantly worse. How can that happen? I mean, I know the body's a mystery, but do you see that often?
So we think about
Lifting
with
weights?
that, I think about the mechanism, right? So because this has to do a lot of times with mechanical stimulation, we got to think about what's going on. So part of your health goal would need to involve really strengthening the weight bearing exercises from the arms. So maybe thinking about wrist weights or doing those like plank positions if your wrists can bear that without it being too tender on your joints there. So yeah, I'm making sure that you're adding that back in, but it sounds pretty encouraging that you're going in the right direction or at least stabilizing with the other areas. So my thought would be just shifting, kind of think of it as, your own personal trainer there, or you could even ask a personal trainer like a Pilates instructor or somebody like that to give you specific moves for that zone of your body.
Okay.
And that might be, thinking about that vibratory platform or something like that can be really
was cool.
phenomenal. Yeah, I love that one. So
Yeah.
any other thoughts, docs?
My other question is, how much D3 should a person be taking a day?
That's a really good one. Do you guys want to answer that?
Yeah, definitely. So that, there's in the medical community, the recommendations around that are pretty variable. In absence of, of knowing someone's D status, will often go for around anywhere from 2,000 to 6,000 IU in the winter time. But I often like to test just to make sure that someone is not either too low or too high, because like Dr. Rosalie was mentioning, when you're too high, that can cause pretty severe problems. So um, it can be challenging to get enough vitamin D in this climate. So that is why, testing and keeping on top of it is really important.
So we love to see that as part of our annual panel here. So we try to run it with our active patients yearly if we can. So looking at that 25D hydroxy level to make sure that it's in our peak zone, just right where we want it, just that perfect zone. So, and if it's not, then we adjust the dose. And it really is amazing how unique that can be for different people. So there's genetic influence with that. There's absorption issues sometimes for people as well. But it's kind of like guessing game. I have some patients who are on 10,000 a day and I get their labs back and they're still low. We switch them to a different form of vitamin D just slightly and they do much better. But you really gotta, it's good to get tested and then, watch for stability over comparison labs. Yeah.
Yeah, and then remembering that vitamin D is a fat soluble nutrient vitamin, so you need to have it with food. That's kind of a key thing that will often affect people's levels over time.
Okay.
And then of course we know K helps with absorption with it too. There's all kinds of little keys here with it, but yeah, getting levels checked is always the best way to start. And then same thing with like, maybe also checking like estrogen levels too. If you're like, well, I've checked every other box, it can be nice to know what's your physiologic balance like there, since that's so impactful for bone. Dr. Rosalie, do you have anything else to add? We've been kind of gabbing.
No, I think you covered it pretty well. Combining it with the K, getting sunlight when you can, and finding the correct form.
Okay.
There's
Thanks
another.
a lot.
Thank you for the question. There's another question in our chat box, and that is, how do you vet your pharmaceuticals?
So I'm not sure if that question is asking about pharmaceuticals, like prescription drugs, or if we're talking about like the physician grade nutraceuticals, which are considered more supplements. But in regards to what we carry in our apothecary here at Prosper, we're really careful to use physician grade only products whenever we can. And what that means is they have independent testing done on them to make sure that they are what they say they are. And then a lot of them have clinical trials that have been done on them. And then we're also often really looking for, I think it's called a GMP standard, which means that as far as the manufacturing itself, it has its own level of critique and specific standards that have to be met. And yep, so we're doing that. And then we also then take those supplements, and then we're real picky about what we allow in there. So we're trying to only get things that have the better available forms and don't have a lot of synthetics or cheaper but poorly absorbable nutrients. So yeah, we're pretty selective. Everything that's in there pretty much is handpicked by one of us three or all three of us. So I think that was what that question was going for. Any other questions? I hope that answered it.
I don't see any more in the chat.
Okay. Well, thank you guys. Thanks for joining. And hope you are well. If you do need anything from our apothecary, it is available online, so you can jump onto our website. It's not the fanciest, but we've got 3 different portals there that allow people to order supplements through our apothecary, or you can give us a ring and we can set it up so it's put in the Dropbox for you, or you can pop on in person now, which is great. All right. Take care. Happy holidays.
Bye.
See you guys next time.